Knowing how to perform basic first aid is important because sometimes small accidents happen when you're home alone. I am here with a nurse who can give us some tips.
It's important to know what to do when you are at home when a medical emergency may come about. It's scary to think that something may go wrong, but the truth is accidents do happen. It's important, even as a kid, to know what to do when there's a medical emergency. Knowing basic first aid and that to ensure the area is always safe are some good tips to start with.
What are the items in a first aid kit?
It's important for families to have a first aid kit. It's good to have it in a place that's easy to find but out of reach of small children. Items to include in the kit are Band-Aids. There are plenty different sizes. An ace bandage, which is much larger. Medical tape. A blunt-ended scissors. Tweezers. Antiseptic ointment. And hydrogen peroxide or rubbing alcohol. Gauze. A cold pack, or even some gloves.
Why do I need to use gauze? Why can't I just use a tissue?
That's a good question. When a tissue gets wet, it easily breaks apart. But when you get gauze wet, it stays together.
How do you safely put on a bandage?
You see this white part here on the bandage? That's where you want to put where you have your cut. That way it doesn't stick to it. When you take off these white pieces, these sides are sticky, so you don't want that area to touch your cut. And you want to make sure that this stays straight. So here's how we would do it. You want that white part over your cut and keep the sticky part straight. Now if you have a bigger area, you might need to use an ace bandage. Now this bandage can get kind of tight, so you want to make sure that the area that you're putting it on doesn't get blue or white or tingly feeling, but you want to make sure that it's snug enough around. How does that feel?
Good. How do I know when a cut is small enough to use a Band-Aid or to call 911?
When someone is bleeding in a small cut, you can just put a gauze on or even a Band-Aid to hold over. But if the bleeding doesn't stop, it's serious. You should call for help. You can put more gauze or a clean cloth, like a towel, on top of that bleeding area and hold pressure there. You can keep adding more gauze or another towel, but don't take it off once you start holding pressure until help comes. And as soon as your help comes, make sure you're washing your hands with soap and water after dealing with blood.
What do I do if someone is choking?
That's a good question. Do you know what the universal sign for what a person does when they're choking? Right, they put their hands up around their throat, and a person is choking if they can't cough, speak, breathe, or they're barely breathing. Go to the person who is choking and clear the area or throat by using back blows and then abdominal thrusts to help them breathe.
What happens if they stop breathing?
Call 911 right away. You want to lay that person down on a hard, flat surface and start CPR. Start with compressions and then rescue breathing.
What do I do if I'm the one that's choking and there's no one else around?
You can do abdominal thrusts on yourself. Place your hands in the same place but over yourself, and you can lean over a chair or a low counter.
Sometimes I make food in the microwave and there is a possibility that I can get burned when I'm taking out popcorn, for an example. What do I do then?
You would take your arm or the area that got burned and soak it in cold water. Don't use ice at all, and you can soak it for about 5 to 15 minutes. When you take it out, if it looks like sunburn, you can put an antibiotic cream on and then a Band-Aid over it. If it still hurts, you can put it back in water for maybe about 5 minutes. Or if when you take it out, it looks white, blistered, or oozing with things out of the burn, then it's serious and you should call for help. You can cover the area with a cloth, but if you have clothing stuck to that burn, don't try to take it off.
How do I stop a nosebleed?
If somebody has a nosebleed, he or she should sit with their head upright, lean slightly forward. You can use a tissue or a cold cloth to hold on your nose. Pinch your nose for about 10 minutes. If the bleeding doesn't stop, call for help.
What should I do if someone has trouble breathing?
Well, if you've just been playing or running around, try to have them sit down and relax for a while. Take a few deep breaths. If it's someone that uses an inhaler from their doctor, ask them if you can go get it for them, but they should know how to use it. If you've just been eating, that person may be choking, so be sure to follow those steps in choking. If at any time someone's lips should turn blue or gray or should stop breathing, you should call 911 right away.
Sometimes I get a stomach ache. How can I make it feel better?
Sometimes you need to just try to go to the bathroom. It might be just gas. Otherwise, lay down and rest for a while. If the pain is still getting worse after you have rested, then you can call for help. If you have thrown up, lay down and rest and place a cool washcloth on your forehead. If your vomit is bright red like blood, dark brown like coffee grounds, or dark green, then that's serious and you need to call for help right away.
What if I am playing and someone falls down and hits their head?
Try to move them to a comfortable area and lay down. You can use a cold pack or even a frozen pack of vegetables to place on the area that they hit, like their head, to reduce the swelling. If that person starts acting strangely, if they vomit, they're dizzy, they black out, or they complain that their vision is blurry, that they can't see very well, that's serious. You should call for help.
What if they fall and they hit somewhere else besides their head?
Well, if they may fall and hit their arm or leg and you notice a deformity, say it's not going in the right direction, try to keep them still. If that area turns blue or white, or they can't feel it, or if it's tingling like there's needles, you want to make sure you're calling 911. If there's bleeding or an open cut, you can always place a cloth there, but don't hold too much pressure on that area.
What if I'm playing outside and I get stung by a bee?
If you think you got stung by a bee, you should call for help. Some people are allergic to bee stings, so if you start noticing hives, which are red patches that itch that are on your skin, or if you get nauseous, dizzy, a tight feeling in your throat, or trouble breathing, that's serious. You should call 911. If you still see that you have that little black stinger in, an adult should be removing that quickly. Be sure you call for help.